Good morning, students. So, how are you all? So, happy good morning to all. So, welcome to Community Health Nursing class. So, today we are going to see about RCH program, which is being integrated under Family Welfare Program. So, definition is people have ability to reproduce and regulate their fertility. Women are able to go through pregnancy and childbirth safely. The outcome of pregnancy is successful in terms of maternal and child survival and well-being, and couples are able to have the sexual relationships free and fear of pregnancy and contracting diseases. So what it is saying is that the people can regulate their fertility by using the contraceptive measures, and there is no fear about the pregnancy or childbirth, because now presently maternal mortality and infant mortality is very less. It is reduced very less because of hospitalized in deliveries, and we are having advanced technologies to save the lives of mother and child. So the success of this survival rate of mother and child is great extent. So we don't have much of morbidity or mortality cases because of the delivery, and the couples are able to have sexual relations free of pregnancy and of contracting diseases, because they can choose any of the contraceptive measures which helps to prevent pregnancy. Not only pregnancy, all type of sexually transmitted diseases can also be prevented by using the appropriate contraceptive method. So that is about reproductive and child health definition. Coming to the objectives: to promote the health of the mothers and children, to ensure safe motherhood and child survival. For that, various starting from the once the mother is pregnant, starting the initial stage itself, the mother has to register, and followed by she has to take the regular medications, follow up hospitalized delivery. So all these helps to prevent the safety of the mother and child survival. Intermediate objective is to reduce IMR and infant mortality rate and maternal mortality rates. So that comes as an objective. Ultimately, the objective is the population stabilization through responsible reproductive behavior. So by using all these contraceptive measures and pregnancy and delivery in a hospitalized institution with proper medications and regular checkup helps to prevent all kind of health issues during the time of pregnancy or delivery. We are having two phases under RCH, RCH1 and RCH2. RCH1 includes four components, that is family planning, child survival and safe motherhood, that is CSSM component, client approach to healthcare, prevention and management of STD. So these are the four components coming under that. In that, child survival and safe motherhood is mainly focusing about early registration of the pregnancy, minimum of 3 antenatal checkup, universal coverage of pregnant women with TT immunization, proper food, nutrition and rest for the pregnant ladies, detection of high risk cases and prompt referral and delivery of these high risk cases in a super specialty hospitals, clean deliveries by the trained personnel, birth spacing from one child and the second child, promotion of constitutional delivery. So all these are the main components coming under CSSM. Thereby we can able to reduce infant mortality and maternal mortality rate. Other interventions coming under this RCH program is essential obstetric care, emergency obstetric care, 24-hour delivery services at PHC or CHC, medical termination of pregnancy, control of reproductive infections and STDs, immunization, drug and equipment kit, essential newborn care. Oral dehydration therapy, acute respiratory disease control, prevention and control of vitamin A deficiency in children, prevention and control of anemia in children. So these are the various interventions that is coming under the first program, that is RCH1. So little brief about these components. First one is essential obstetric care. So we already learned in MCH services about this in detail. So during the time of pregnancy, initial stage, once the lady is come to know that she is pregnant, immediately she has to register, and minimum of 3 antenatal checkup she has to done with the obstetrician. Provision of safe delivery at home if the individual is not ready to have a hospital deliveries, and 3 postnatal checkups also. Emergency obstetric care is to prevent maternal mortality and morbidity. First referral units will be strengthened through the supply of emergency obstetric kit, equipment kit, provision of skilled manpower on contract basis. traditional birth attendant training. So in case of we have seen essential, that is the basic necessity of obstetric care during the time of pregnancy. Emergency means in case of any kind of risk for the mother, high risk cases, then we have to see for it that the mother and the child is saved by proper special super speciality or specialized individuals must take the deliveries, that is a skilled manpower, and special obstetric kits are being provided and equipments are being provided and all other medications are being provided, so that even in the high risk cases both the mother and kid can be saved. 24-hour deliveries at PHCs or CHCs. So to promote institutional deliveries, it's not compulsory. If the mother is having pain of delivery, immediately the mother has to transport to nearby hospital and they have to travel a long distance. During the time there is a chances for mother to get delivered. So to prevent that, now presently in all the villages we do have the PHCs. In the PHC or in the CHCs we have 24-hour delivery services, and there are staff who is well trained to conduct the deliveries. Honorarium to the staff to encourage round the clock delivery facilities at health centers. So there will be ANMs and grassroots level workers. ASHA workers will be monitoring the regular progress of this pregnancy. So even she can motivate the pregnant ladies to come to have a delivery in the nearby PHC or CHC. So if the ASHA workers or the ANM or grassroots level workers are bringing this pregnant lady, motivating and bringing them to the PHCs to have the deliveries in the institution, as a motivation is honorarium of a stipend, specific rupees is being provided for the grassroots level workers, so that they will get motivated to bring more and more pregnant ladies for institutional deliveries. Medical termination of pregnancy. The aim is to reduce the maternal mortality and morbidity from unsafe abortions. If the mother don't want to continue the pregnancy, then she want to terminate. No need for the mother to go to quacks or take some other medications which is not supposed to be taken by them. So in that way, over the counter medications if the mother is taking, or if the mother is going to any quacks and having unsafe abortions, which can lead to various other maternal complications, even mortality and morbidity can happen. You might have seen a movie called Notebook. In that, how that girl is going to a quack and having the pregnancy terminated, and what happened to that lady. So similarly, these kind of issues can happen, is be happening in our country. So to prevent that, we are already legalized this MTP in lot of hospitals. They are doing this MTP services. So if they don't want to have the pregnancy to be continued, it is legalized to have the MTP Act, and they can terminate the pregnancy under physician who is trained for doing that. No need to go to the any quacks or taking over the counter medications and making issues complicated. The assistance from central government is in form of training manpower, supply of MTP equipment, provision of engaging doctors trained in MTP to visit the PSC on fixed dates to perform MTP. It's not only done in the hospitals, even in the PHC and CHC are also doing this MTP services. So every week or once, twice in a month, this skilled obstetrician or gynecologist is coming and they are doing this MTP services. So they can have these services even in the PHC level also. Control of reproductive tract infections and STDs. So National AIDS Control Organization will provide assistance for setting up this STI, STD or RTI clinics, because because STI and RTI is leading to is progressing to a state of AIDS. So to prevent that, more and more awareness is made in the public about the use of contraceptives, thereby not only the pregnancy, even STD, RTI and other sexually transmitted diseases like AIDS, major disease like AIDS can be prevented. Each district will be assisted by 2 laboratory technicians on contract basis for testing the blood, urine and STD test. So that is being done. Now these STD clinics are more prevalent in all the PHCs. Now people are much aware about this, and they started coming to the clinic to get the services done. Immunization, universal immunization program became part of our SAGE program from 1997 onwards. It will provide